Hi, I'm Dr. Trevor Corneil, Medical Health Officer for Northern Health. I'm here to update you on the Omicron wave of COVID-19. Omicron is the newest variant to appear on the scene. However, what makes it unique is the impact, the exponential growth, which we see here across a number of familiar countries, United States, United Kingdom, South Africa, and of course, here in Canada. This exponential growth has been seen across the country in every province. However, British Columbia seems to have fared better. We believe this is because of the public health orders that were put in place prior to the holiday season. The result has been fewer persons admitted to hospital per 100,000 population. It's important to note that we too are experiencing an exponential growth in BC. And in Northern Health, we appear to be on the upward curve of our Omicron wave. Genotyping of virus samples shows us that Omicron is now the dominant variant in BC, shown here in red. However, there is still a small amount of Delta circulating, seen here in the light blue in Northern Health. Omicron is far more infectious than previous variants, and we see that in this model showing exponential growth day over day over day, or the course of a week. The result is, unfortunately, more persons admitted to hospital, despite the fact that overall it causes less severe disease. What is still true is the greater proportion of admissions to hospital continue to be in the under-vaccinated and unvaccinated individuals. The elderly continue to be at highest risk for severe illness, as do persons who are unvaccinated. Early evidence has demonstrated that the two-dose vaccine series is less effective in preventing transmission, hospitalization, or ICU admission. However, a third or booster dose brings that vaccine effectiveness back to close to normal levels that we saw with Delta. As such, booster dose is now recommended for all adults in BC. Here's a summary of what we know about Omicron today. What is different? Well, Omicron is more transmissible by 50 to 100%, depending on the context and the vaccine status of a given population. The growth rate is higher, doubling every 2 to 3 days instead of every 1 to 2 weeks. The infectious period is shorter at 2 to 3 days, making contact tracing and case and contact management much more difficult. There are more breakthrough infections and more reinfections, in large part due to the lower effectiveness of COVID-19 vaccines in the absence of a booster dose. The good news is there's less severe disease, with about half the hospital admission rate and far fewer persons requiring critical care. So what interventions still work? Well, vaccination with an increased emphasis on a third dose is still the most powerful tool in our toolbox. Public health orders that limit uncontrolled close contact with large numbers of people may still be effective, but we're evaluating this in the coming weeks and months to see if changes need to be made. Case and contact management in high priority settings and high-risk under-vaccinated groups is still very important. And we're now recommending PCR testing for persons in all high-priority settings and for identifying those who are at higher risk of severe disease so treatment can be offered. Treatments are the newest tool we have, Monoclonal antibodies have been available for several weeks, and around the corner are antiretrovirals, which can be taken orally and prevent severe disease. Takeaways from this presentation: as we shift from a pandemic to an endemic stage of COVID-19 in BC, we need to continue to evolve our practice and focus our efforts on what works. Our goals remain the same: to support those who are most vulnerable, to prevent severe illness, and to protect our healthcare system. Last but not least, this is likely not the last chapter of Northern Health's COVID-19 journey. We have yet to see what is around the corner. Thanks for listening.